Hi, everybody. Welcome to this very special presentation and discussion on the invisible crisis, professional women in the sandwich generation. And this next half hour or so is largely intended to be me presenting really kind of a thought leadership and a point of view piece on the state of women and elder care and caregiving in this country. And it really is part of a broader discussion about America's elder care caregiving crisis that's currently happening in this country that we need to be bringing more visibility to, talking more about. And so that's why I'm here today with all of you talking about this very, very important topic in our society, in our country today. So, before I get into it, just quickly, by way of introduction, my name is Kathleen Korpela. I am founder and head coach of a coaching and consulting practice for women who are sandwich generation caregivers. And so I help them better care for their aging parent and themselves and navigate the caregiving journey, that they go through while their parents are aging and while they're caring for kids simultaneously. The caregiving experience is a profound journey, and it's one that's filled with lots of joy and tremendous challenges logistically and emotionally. And I work with women to educate them, coach them, support them, empower them in their caregiving journey and caregiving experiences. And so, just a bit quickly on my personal story and my caregiving journey, and really how I came to found this mission focused business and a specialized group program for women that I run. I was actually a family caregiver for my father for almost 8 years, who passed away from Alzheimer's dementia last year. And I remember it very distinctly, almost 8 years ago, where my father got his dementia diagnosis. And I had two very young kids at the time. I had a 6 month old and a 4 year old. And I was actually a week away from going back to work after my second maternity leave with my 6 month old when we had received my father's dementia diagnosis. And that really catapulted me and my family into crisis mode. And I didn't realize at the time, but that was the point at which stepping into the roles of being a family caregiver for my father had really found me, and quite suddenly. And it wasn't really through that whole experience and a good couple of years into it did I really realize how woefully unprepared I was for navigating the caregiving journey, stepping in to help care and coordinate care for my father while grappling with other competing demands like my professional career and raising my young kids. It was really, really a lot. And I realized how little I knew about navigating the world of elder care, dealing with dementia, elder care plans, planning for and paying for long term care, the emotional aspects of, supporting a parent through their later and last stages and end of life. It really, really was a lot. And my experience really showed me firsthand how little support there is out there for family caregivers. And so that was really the impetus for me starting this coaching company, and why I'm so focused on helping women better care for their aging parent and themselves throughout this really challenging journey, of phase of their life. So I want to transition to talking about the state of caregiving in this country for elder care and family caregiving. So if you're caring for an aging loved one, first of all, know that you are not alone. And the research and statistics tell a story of caregiving's prevalence and the growing importance of support for professional working women who are sandwich generation caregivers. So, just some stats here. So, there are about 53 million adults, at least, and definitely growing because this stat is a little bit old, but at least 53 million US adults are family caregivers and playing that role assisting their loved one. And by the year 2030, so I mean, that's like, less than 5 years from now, the number of older adults needing care will outweigh the availability of family caregivers and people able to support their loved ones. And further, 70% of primary sandwich generation caregivers are women. And they report very high levels of emotional stress and grappling with challenges of balancing caregiving duties with their other competing demands compared to that of men who are doing it. And there's another personal cost here that no one really talks about, which is, when women are losing, somewhere between 324,000 in lifetime wages due to caregiving responsibilities. So that comes from having to step down in your career or step out of the workforce completely to manage caregiving and elder care responsibilities. And when you do that, you're not able to contribute to your retirement accounts, 401k accounts from work. So there is a very real economic cost when women step out of the workforce, step out of their careers to deal with elder care and caring for aging parents. It's, obviously a similar story when they step out of the workforce to care for young children. And that's increasingly becoming the same here, which has tremendous economic costs. And this isn't just about money, right? It's about their dreams deferred. It's about careers derailed and careers and advancement in their careers not realized and future sacrificed for, what we as women really want and need, right, in our lives. And so, there is so much truth to this. A lot of this just is not really being talked about right now. And so I want to dig a little bit deeper into really the magnitude of the caregiving crisis that we are talking about that's coming upon women in particular. So who are we talking about here? So this is women, in midlife, 35 to 55, right? At the peak of their career, at the peak of their caregiving responsibilities from the middle, right? Where they've got kids at home under the age of 18 and aging parents with increasing needs for help and support. 56% of working caregivers are women. That's more than half. And I want to mention also the rise of what I call the maternal breadwinner phenomenon. So this is, mothers over the age of 45 increasingly becoming primary earners in their household, right? While at the same time, simultaneously becoming primary caregivers for their aging parent. And so, they're really at this mid stage in life where there's a lot of competing pressures and demands on their time at the same time that they're in their sort of peak career stages, peak earning stages. And so there's a lot at stake in terms of, maintaining your career, maintaining the momentum you've gained in your career and not stepping out to, for caregiving responsibilities. And these women are finding themselves in a double bind reality. 70% are struggling to balance their career with caring for aging parents and caring for kids. I'm surprised the numbers, not higher. 40 to 70% of women family caregivers experience symptoms of depression, anxiety, stress, overwhelm, burnout, the emotional toll, to say nothing of the time demands, is very real. And 23% report physical health declines too, where these anxieties and these stresses of elder care, caring for children, managing your career and the other, responsibilities, your marriage as a spouse and a partner, running a household, it really takes a toll physically, as well as emotionally and mentally. And the economic impact of all of this is significant because, once again, right, caregiving responsibilities, end up forcing women out of the workforce in their peak earning years. And the ripple effect on that is, again, they're not able to save for retirement, for their future economic and financial security. And the way that the Social Security system benefit is structured today, if you're not paying into that system, through your paychecks, you're not able to benefit. You're not paying into that system when you step out of the workforce to care for an aging parent. And so they're limiting their ability to receive and qualify for Social Security benefits, when they retire and they need to. And so all of this amounts to higher chances for greater economic insecurity later in life and increased poverty later in life for women who are, taking on these critical roles of providing care for our loved ones in our society and in our families, right? And even beyond the demographics and the statistics, the lived reality at the individual and the personal level is really so, significant. um, you know a lot of us who are listening to this and maybe can relate understand the morning juggle, right? I mean, your to-do list starts before you've even, gotten to work, right? At 8 or 9 a.m. or whatever that is you start your workday. Your pre-morning time is incredibly full with logistic, administrative responsibilities. It's just a very full plate. And you're looking at, career trade-offs and having to make hard decisions around that. And again, this is just at the day-to-day level, thinking about how you might need to miss important meetings for medical, emergencies for your mom or your dad, or having to work late to feel like you need to compensate for caregiving interruptions that might come up during the day. But then you're also maybe feeling guilty for missing family time because you're, logging on late at night, right? And I think behind all of that is this fear in your mind of, am I failing everyone? Right? Am I failing anyone? So having to make these trade-offs between caregiving responsibilities and work is very real and very hard. And that takes an emotional toll, right? There's the feelings you have around guilt, the feelings you have around isolation, right? If you don't have friends with caregiving responsibilities that, maybe can't relate to what you're grappling with and what you're going through. Feelings of resentment can be very real, right? Why is this my responsibility alone? Or why aren't my siblings helping out more? How did this fall on my plate? Or not wanting to really be in this role of caring for an aging parent. It's very hard. And so symptoms of resentment are very real and very normal. And grief, right? You're going through a grief process where you're mourning the loss of the parent you once knew, right, while they're still alive, because they're losing their mobility, right? They're losing their abilities to manage in their everyday life, or they're experiencing cognitive decline. And that's very challenging. It is a grief process when you think about the aging and decline of your parent. And, all of this amounts to reaching physical breaking points for many women, right? Sleep deprivation, stress related health issues. The tragic irony is that caregivers are, becoming, patients and needing help themselves, to deal with the emotional and the physical toll that these caregiving demands without support and education and help are really putting on you. So what's contributing to a lot of this is largely systemic, meaning that the system around us and the environments that we all live and operate in are largely broken, right? And behind the times. We don't have at a societal level the infrastructure to support care, to support family caregivers. And, by extension, that largely falls to women, right? It's a system that is largely failing us. We have a policy vacuum, right? We don't have in this country, the United States, comprehensive family leave policy for elder care like we do with childcare. We don't have tax credits for elder care expenses, equivalent to childcare credits that certain families can qualify for. There doesn't exist workplace protections for women and men who are working caregivers and have caregiving responsibilities. Most companies, the majority of companies, don't even have elder care policies in place. And according to some research that was recently conducted by AARP and S&P Global Research, only 25% of organizations in the US offer paid family leave for elder caregiving, and only 19% offer some form of subsidized elder care. And so, at the corporate level, we have a tremendously long way to go in making strides in supporting family caregivers, supporting working caregivers that have, elder care responsibilities. And, there's what I call, cultural blindness, right? There's a lot of the labor, the caregiving labor is invisible because it happens largely in the home, in private settings. And we also have still a society that has come a long way, right, in really celebrating motherhood, but largely ignores daughterhood, right? Largely does not celebrate what it means to be a daughterhood caring for an aging parent at their end of life. And elder care is seen as women's work rather than a societal responsibility, or rather than a responsibility that's shared across the genders, right? Across men and women. And there still exists an expectation that women will naturally sacrifice their ambitions, right? Their professional ambitions, career ambitions, or whatever that might be, their entrepreneurial ambitions for family needs. There's still that expectation, that cultural expectation out there. And then we've touched on, needs at the corporate level, but what I call the professional penalty. So, I mean, there exists today caregiving bias in hiring and promotion decisions. Companies are assuming that that women who are caregivers that have caregiving responsibilities at home are less committed to their careers, right? And even in the workplace today, there isn't a recognition of a lot of the transferable skills gained through caregiving, right? I mean, caregiving is sort of like high stakes project management, with sort of high emotional stakes, right? And you're grappling with, dealing with emergencies and crises, and advocating for your loved one in different types of settings. And a lot of these skills that we learn and practice in caregiving are largely transferable into the workplace and into our day to day work, and how we perform and contribute as employees and leaders in the workplace. And there really is not recognition of any of that in the workplace. It's just the case that the United States, right, again, doesn't have the infrastructure in place to meet the growing elder care crisis in this country from multiple dimensions. And the ripple effect across society is significant. There's what I call the workforce brain drain, right? Millions of experienced, educated women are being forced to reduce hours or leave their careers entirely, step out of the workforce. And companies are losing that institutional knowledge. They're losing that potential of leadership from women. Companies have already been struggling with this, with women who are stepping out of the workforce and leaving to care for children at home. And this trend is going to become exacerbated and increased as more and more people are stepping into their later years of life. We have an aging population. More and more women and men are going to be taking on caring for an aging parent. And so, this trade off of having to make these decisions around stepping down from careers or leaving the workforce and grappling with this brain drain is going to become an increasingly significant issue. And the economic and GDP impact of this is significant. There's billions lost in productivity and economic contribution from women who step out of the workforce or have to leave the workforce entirely due to caregiving. So all told, there's, estimates now, if you research has shown, if you factor in, lost employment, higher absenteeism for women who are, missing work to have to deal with caregiving responsibilities, and compromised employee health. Maybe they're taking mental health days or sick days to care for themselves as well. Family caregiving is costing the U.S. economy 264 billion annually, and that number is growing. So this has significant financial and economic consequences at a societal and economic level. And there's what I call the generational trauma. So this is, as we think about a society, what we are perpetuating in terms of gender roles that really harm everyone. So, what we're teaching girls, what we're teaching our daughters, right? That success means sacrifice, or, caring for others means not caring for yourself. And that, women's ambitions are expendable because we're making these trade-off decisions. So we have to really reflect on what are we, at a societal level, at a corporate level, and even at an individual level, within our own families and households, what are we teaching and conditioning our and role modeling for, our daughters and the girls in the future generations? And then similarly, what are we robbing the boys of, right? Our sons, the future generation of men, right? We think about missing the opportunity for them to develop caregiving skills and emotional intelligence when it's, women or mothers that are handling the elder care responsibilities. And what we're inadvertently doing is creating households where women bear disproportionate responsibility of care and caregiving duties. And so, men grow into boys, boys grow into men, they get married, they have their households with their wives and their spouses, and they're not prepared for mentally, emotionally, or, from a conditioning perspective on equal distribution of labor in the household. And, that extends to caring for aging parents as well. And so there's multiple ripple effects, right, from a society, from a corporate level, from an economic level, and from a household and a family and a household role level. And then you also have the intersection of all of these challenges I've talked about that creates even more hurdles for, women of color, for single mothers, excuse me, for rural women who are family caregivers and maybe have, live in locations where there's limited infrastructure or fewer professional opportunities. And then you also pile on the socioeconomic and the demographic dynamics at play, where again, we have an aging population, we have rising costs of care, we have inflation that impacts us day to day. And we have families that are waiting to start families and have kids later in life. So all of these socioeconomic and demographic factors are what is resulting in people increasingly finding themselves in the sandwich generation and caring for multiple generations at the same time. It's very, very challenging when you're dealing with these dynamics, or you have multiple identities where a lot of these intersections of these challenges and hurdles are making it very, very challenging for professional women. But what's also critically important in all of this, and what we need to acknowledge is, first and foremost, this is not a personal failing, right? There we have a system that is broken, right? It's not the women that are broken. We have a system that is largely broken. So this is not a personal failing. And what we do need to acknowledge is that this is an emergency. This is a caregiving crisis, right? It's just that it's not talked about nearly enough, right? Like I said earlier, giving care is largely invisible because it happens in private settings. It happens in the home or it happens in senior care facilities. And it's just not talked about, nearly enough in our workplaces, in our households, out in social media, in larger forums. It needs to be brought more to the to it needs more visibility for the crisis and the emergency, that it is. And then there's the questions that we all should be asking ourselves, and to employers, right? How are they supporting employees that are working caregivers? And to our elected officials and policymakers at the policy level, how are they addressing the economic impact of caregiving and of unpaid family caregivers and so many of the aspects of the crisis and the demand for caregiving that's coming upon this country very rapidly. And we also have to ask questions within ourselves and our own families and our own households, right? So questions like, what conversations and preparations need to happen before a crisis or an emergency hits with my mom or my dad or my mother-in-law or my father-in-law? And, conversations with our spouses and our significant others on, or our brothers and our sisters, our siblings on, how can caregiving be shared more equitably, caregiving tasks and responsibilities? And there's also questions that we need to be asking ourselves as well, right? How prepared am I for this stage of life? When it comes onto my plate suddenly or finds me gradually, am I prepared for that? Are very important questions to ask before you find yourself grappling with an emergency or a crisis. I really significantly feel that we stand at a critical juncture in time, right? And so, on one hand, we have a responsibility to acknowledge this as the public health and economic crisis that it truly is. And, on the other hand, we also have a responsibility to take action in our own lives, right? Really for ourselves and for the ones that we love. And, the stakes are high, right? Very high for women that are currently caring for an aging parent, women that are going to be caring for an aging parent. And the stakes are high for the next generation, for our sons and for our daughters, our kids, right? We need a different model of how caring for another one, caring for our elder, and succeeding and caring for ourselves at the same time can coexist together. That's it's just such a big gap in any concrete models that we have today, and the opportunity for society and employers and the corporate world to harness the 56% of the caregiving workforce that is women, right? That is largely untapped or stepping out of the workforce. There's just such a missed economic opportunity there. And so what I like to do is really put to my listeners and the members and the clients that I work with, and the groups of women and men that I speak with about this, is to have a couple different call to actions, because there's always things that we can do in our lives, from a taking action perspective. And the first call to action is really around awareness, advocacy, and allyship. And there's several things that you can do here, in the workplace. If you're um, uh, currently working in a company, you can propose or join an employee resource group for caregivers. You can show up as an ally for your coworkers and fellow employees that you know are caring for an aging parent, right? It's really important that we work to normalize conversations about caregiving in the workplace. So the allyship and the advocacy for working caregivers is very, very important. And then at the policy and the political level, elected officials need to hear from their real constituents, on these issues. So I would encourage you to think about maybe what are key policies to advocate for, and some of the ones I've talked about earlier, right? Family and Medical Leave Act expansion to include elder care responsibilities. There are some today, but there's a lot of holes with that Family and Medical Leave Act that exists at the federal level today. And tax credits for elder care expenses, right? Equivalent to childcare tax benefits, Social Security credits for caregiving years to protect retirement security. That is not something that exists in place today. Medicare expansion to cover long-term care services. Medicare doesn't cover long-term care for aging and older, Americans. And workplace protection laws preventing discrimination and bias against caregivers is really, really important. And then there's what I call the multiplier effect. So, when you use your voice, your social media channels, your friends, your network, right, to build awareness about the need to advocate for family caregivers, women caring for aging parents, it's very, very powerful because it normalizes caregiving, right? It brings it out into the open. It makes it less invisible. It invites others to share their personal journeys, their personal struggles, and what maybe they're grappling with. It really also encourages others to show up as advocates as well for caregivers. So there's a lot around the awareness, the advocacy, and the allyship that really can go a long way. And then the second call to action is really around seeking support and investing in knowledge. It's so important that we think about, while we advocate and evangelize at a sort of a bigger systemic, societal, cultural, policy, and corporate level, we also take responsibility and think about the individual and the personal level for all of us through seeking support and investing in knowledge so that those of you that are currently caring for an aging parent or close to stepping into one, or it's coming, or you can sense you're already there, but you're not quite sure what to do, or you're grappling with overwhelm, it's so that you can navigate this journey well and you can overcome this overwhelm. And investing in resourcing and knowledge to seek out that support where you break your isolation, right? You can have community with other women or other family caregivers that are sharing your experience. And so, investing in gaining information and support for yourself and the one you love is critically important. And the type of women that are investing in knowledge and support are really gaining meaningful outcomes for themselves and their families. They are gaining better balance in their lives, right? So again, they can overcome that overwhelm and that fear that comes with managing the demands of navigating the world of elder care and stepping into this caregiving role. And they're getting education and information and insights on critical and complex elder care topics so that they can work with their loved one and their family to put a plan in place and become an informed advocate for their parent and really have the confidence and the knowledge to know that they're making the right decisions on behalf of their parent or guiding their parent to make the best decisions, for themselves. And women are also that are, stepping into this, the type of women are feeling significantly less alone in what they're going through, right? They are seeking out safe places where they feel heard, they feel seen, they feel understood. And because of that, they emerge feeling relieved, feeling so much better, right? Like a weight has been lifted off their shoulders. And loneliness when caring for an aging parent is very real. And it's easy to feel that you're alone in this. And community and support from women and working with coaches like me who, are women who are going through the same things or people who have been through caregiving journeys will be an empowering source of strength for you. Like so many women out there that have really sought help. And so I would really encourage you to take action on this for yourself. And so I want to transition to talking about the group coaching program that I run, which is really intended to provide expert education and support for women who are caring for an aging parent. It really is an empowering and innovative program tailored specifically to the unique needs of women. And it really brings together elements of self paced online learning modules, weekly live group coaching and community support calls. One on one coaching with me as the head coach, getting expert support and guidance when you need it, and getting you access to that exclusive community of women going through the same thing. And it really is intended to transform the lives of women that are caring for aging parents across, a number of different dimensions through strategic education. I have a caregiving pillar that I'm going to get to in just a minute called Caring for Another, and another curriculum pillar called Caring for Yourself. And so, through strategic education, practical tools, and compassionate group mentoring that I facilitate, I enable so many remarkable women to be able to make informed decisions, establish healthy boundaries with their loved ones and with others, create sustainable systems that work for their unique situations. And my approach is very comprehensive and it really helps women shift from surviving to thriving and from grappling with burnout to a place of much greater balance and to having uncertainty and the fear that comes from that with much more purposeful action because they have information and knowledge now and they can make better informed decisions. They're not ignorant. And they're grappling with isolation and getting that community support that they need. And so I want to talk a little bit about the results of this program and the women that go through it. You're going to gain the information, the guidance, the support, the structure, and the accountability that you need to, care for your loved one and to care for yourself. And so the program framework and the structure is really around two curriculum pillars. And I won't go through all of these in detail, but you can read on them here on screen. But one program curriculum pillar I call caring for another. And that is everything around education, information, tools, navigating the world of elder care, putting together an elder care plan across multiple dimensions, living in care arrangements, financial planning for long term care, working with your loved one in interacting with your loved one who has dementia, a number of different things that I've listed here. And then the other program curriculum pillar is called Caring for Yourself. So we address and cover a number of different topics that are specific and unique to women going through a caregiving journey and also trying to manage professional careers and raise children at home. And we talk about a number of things, setting and managing boundaries, managing your time and energy. Being an effective advocate for yourself and an effective advocate for your loved one, navigating guilt and resentment. We cover a number of different things and provide you with the tools and the strategies and the frameworks to support yourself and get to a much better place in your life, even beyond the day to day emotional journey and administrative aspects of caregiving. And so, women who go through this program really end up resulting in a comprehensive, actionable elder care plan that's tailored to your parents' needs and your family situation. That's really, really significant if you don't have that in place today, or if maybe you feel like you have some pieces of that, but maybe you need the type of help to help review what that is or revisit that plan too. And the women in this program are coming out with knowledge and confidence to navigate really complex healthcare systems, complex care options, advanced planning, and navigate difficult conversations with their loved ones about what they want, what their wishes and desires are for their care and, and end of life. And the women coming out of this program are getting proven frameworks for managing their time, their energy, their emotional well-being, while juggling these multiple caregiving roles that they have without sacrificing momentum in their career. And they're also accessing a supportive community of very successful women who understand the unique pressures of balancing career with family caregiving. And it's truly transformational. They are going through this program and transforming from overwhelmed and reactive and unsure to being strategic and, proactive. They're creating a life for themselves and a caregiving approach that honors what their parents need so that they can have the best care in this later and last stages of their life, and a plan and an approach that honors their needs and their life goals as well. It really is a transformative and a significant program that is designed to be very efficient and impactful because I know how time compressed you all are, right, in your lives. And so, if any of this resonates with you, I really encourage you to apply for my signature program. It's called Caregiving from the Middle, and experience what it's like to transform from an overwhelmed to a confident caregiver. So this is really a program for women who feel unprepared for caregiving and navigating elder care. It is for women who want to be a more informed caregiver and a more informed advocate on their parents' behalf, or a more informed advocate for themselves, maybe in their workplace setting as well. It's for women who really would value having clarity and a game plan around financial planning, estate planning, and care planning for their parent, and one that's tailored to their unique family situation. It's for women who are ready to take action and really get support in this area of their lives. And for women who want to feel less alone here. And it's for women who want more balance, they want more confidence, and they want less overwhelm and uncertainty. And it's also for women who really value practical strategies and tools and shortcuts and are looking for a special place, a safe place that provides that support, that empowerment, that structure, and that accountability to do a lot of this too, right? To really get ahead of this in kind of a structured environment to help you do that and keep you accountable for that. Right. And it's being coachable and open to personal growth, open to really stepping into this with open arms and an open heart and an open mind for yourself and for your parent, the one you love. And so I want to end here with some really final thoughts. Number one, remember, you are not alone. You're not alone in what you're going through or experiencing. And there are women out there just like yourself, right? Going through the same experiences and the challenges. And the place to find them, right? The place to connect with them is inside this Caregiving from the Middle program. That is where they exist in this sacred container. And secondly, Know that you do not have to struggle or stay stuck, right? There is a different and a better way forward. And this is true for you in terms of having a plan for your parent, right? The one you love and deeply desire to do right by. And it's also true of yourself, right? Because you're capable and you've lived through a lot of life's experiences already, and you can learn new things and show up equipped to navigate through this next phase of life and experience in your life with a lot more confidence and knowledge than you probably have today. And that's what we cover and equip you for in this program is so that you can emerge with greater clarity, greater confidence, preparedness, and practice, right? That's what it means to really transform from overwhelmed and fearful to empowered, right? To confident. It's really, really transformative. And then lastly, remember that it is critical to trust in the model of an expert framework, right? A group based coaching program that provides transformational results for women grappling for caring with an aging parent is critically important. It's a group program that is educational and support based, right? It brings together multiple different elements of information and education and teaching, tools, strategies, frameworks, and accountability, community and support with other women. And this is a model that is strategically and specifically designed to meet you where you're at and lead you and help you and teach you and empower you from that place forward. And so I want to wrap there and say just thank you very much for listening to this topic on the caregiving crisis in this country, the invisible crisis we have with professional and working women and caring for aging parents, being in the sandwich generation. It really is just a top critical, important topic of our time. And for hearing about the program that I run for women and knowing that help is out there. And so I would invite you to talk with me. I have my contact information here. You can click on this link to learn more about the program, to apply for the program, to see if you're really a right fit. And then I also offer a link here to watch a free masterclass training that I offer, touching on a lot of the things I've touched on today, and some really interesting and neat things that I want to teach you, and some insights and secrets that I've learned from the work that I do working with women. So thank you very much once again. It has really been a pleasure and an honor, and I hope to hear from you soon. Take care.